Hello, my name is Giulia Horan and I will be presenting on ischemic strokes. There are two types of strokes. There are ischemic and hemorrhagic. I am just focusing on ischemic strokes. Hello. So the etiology or the cause or origin of a disease or condition of an ischemic stroke is a blockage in an artery supplying the brain with blood that carries oxygen. There are two main types of ischemic stroke. Both involve a reduction in blood flow to the brain due to a blockage in the blood vessels. Thrombotic is one of them. This type occurs when a blood clot, which will be called a thrombus, forms directly in one of the arteries that supply blood to the brain. It can develop in narrowed or damaged blood vessels, and thrombotic blood clots often form from atherosclerosis, which is the buildup of fatty deposits and plaques on artery walls. Another type is embolic. This type occurs when a blood clot or other debris forms elsewhere in the body, usually the heart, and it travels all the way up. This is a blood clot called an embolus, and it'll stick in a brain artery and cause that blockage of blood from getting to certain areas in the brain. So the main difference is thrombus forms directly in the artery that supplies to the brain, and then an embolus travels. The risk factors for thrombotic, like I mentioned, atherosclerosis, it's the plaque in the arteries, which leads to narrowing and possible clot formation. Hypertension, which is high blood pressure. Hyperlipidemia, which is high cholesterol, that leads to plaque buildup. And diabetes, which over time the blood vessels will get damaged for the blood clot. And then for embolic, some risk factors are AFib. This is an irregular heart rhythm that can cause blood to pool and form clots in the heart. Everything is going to revolve around clot formation. Heart valve disease, damage to our artificial heart valves can cause that. Heart attack and CHF, everything that can cause a blood clot in the heart to form. Some demographics include for people having an ischemic stroke, typically people over the age of 65, people with family history of it / genetics history. Gender, men have a higher risk earlier in life, but women tend to live longer and have a higher lifetime risk overall. Ethnicity, African Americans and Hispanic populations have a higher stroke risk, and this is an image from the CDC, and it basically shows in America and Guam down here, another country, the age-adjusted prevalence of ischemic strokes from 2018 to 2020. The anatomy includes brain vasculature. Like I mentioned earlier, thrombotic is the clot formation within the brain. Embolic is clot travel to the brain. So I want to mention some of the arteries that could be blocked. The carotid arteries bring blood to the brain, face, and neck. Each common carotid artery, which I'll show in the next slide, splits into two branches in the neck, the internal carotid artery and the external carotid artery. The internal carotid arteries include MCA and ACA, which I have down here. Vertebral arteries, they travel upward along the spinal column. They unite to form the basilar artery, which then divides into the PCA, which is one of the cerebral arteries The MCA affects speech, movement, and sensation, typically on one side of the body. ACA might affect leg movement and behavior, and PCA supplies posterior parts of the brain, which can impair vision. Furthering on anatomy, this just shows the CCA right down here. I can't point to it, but it splits into two branches, and the internal carotid artery, where you can see the up at the top, the MCA and the ACA, which primarily supply the anterior circulation of the brain, all the four lobes, frontal, parietal, temporal, and a little bit of the occipital. And then it also shows, yes, just the internal carotid artery, yes. The pathophysiology, I split it up between thrombotic and embolic. This is the thrombotic. I wanted to put in here, physiology is like normal functioning, and pathophysiology refers to the disorder of that process, of the normal. So that usually starts with, or it can, with the plaque formation, where plaque will build up in the walls of large or medium-sized arteries. This can lead to arterial narrowing, whereas the plaques accumulate, it gets smaller, and they thicken. Artery narrowing is called stenosis, and this restricts the blood flow to the brain. It can lead to plaque rupture, where platelets are attracted to the damaged area, clotting factors are activated, and formation of a blood clot or thrombus at the site will rupture, further narrowing or completely blocking the artery. And then ischemia, which is just a lack of blood flow. Neurons in the ischemia area begin to take damage and die if the blood flow is not restored quickly. And then I'll further that in this one. So penumbra is the surrounding tissues that is still salvageable if treated in time. So it has the partial blood supply, but what's mainly affected is the core area, which is directly affected by the blockage, where cells die, which is infarction, and it's due to the lack of blood flow, the blockage, the thrombus. Cellular responses, the cascade, the ischemic cascade, it's a cascade of damaging process occurs, starting with energy failure, where without oxygen carried by the blood, cells switch to anaerobic metabolism, which is reduced ATP production. Ion imbalance with the lack of ATP impairs the sodium-potassium pump, causes swelling and neuronal injury. It furthers to excitotoxicity, excessive release of neurotransmitters like glutamate, which leads to overactivation of receptors and further damaging neurons. And then the oxidative stress causes free radicals to be produced, which worsens the situation. If the blood flow is not restored, irreversible brain damage occurs because the brain tissue won't regenerate. And the surrounding penumbra can be salvaged if treated in time. This is for embolic pathophysiology now. A source of emboli most commonly originate in the heart, like we mentioned earlier, due to AFib, heart valve disease, or heart attack. Embolus will travel to the brain from the heart and lodge in a brain artery, and the blood flow, once reduced or stopped, can lead to cerebral ischemia, which is the lack of oxygen flow, which is also the neuronal injury and cell death if untreated, or just you die. It also includes the ischemic cascade and infarction. Some symptoms, it depends on the area of the brain that's affected. What people mostly talk about when they talk about strokes is how when one side of the brain is affected, the opposite showing will occur. So if the left hemisphere of the brain is affected, right-sided weakness or numbness, and vice versa. People in the hospital, they gave me a card with FAST on it. Basically, you can ask questions. You're looking at their face, arm, speech, and then time is time. Face is seeing if one side of the brain droops. And when you ask them to lift their arms, if one of them is drifting downwards, if their speech is slurred or strange, they're acting abnormal. And then time is just because time is very urgent in brain health. And if the blood gets to it, then that's not good. Diagnosis of ischemic stroke involves a combination of clinical assessment, imaging studies, and laboratory tests. These are done to confirm the presence of a stroke, determine the type, if it's ischemic or hemorrhagic, and identify the cause. Prompt diagnosis, again, to minimize brain damage. The neurological examination includes testing for motor function. You're looking for weakness, paralysis, or facial droop. Speech, aphasia, which is difficulty speaking, or dysarthria, which is slurred speech. Cognitive function, orientation, memory, comprehension, sensation, numbness. The PMSs. Coordination and balance, you want to test for gait and coordination issues if they're walking properly. It furthers into the NIH stroke scale. People or nurses use this to understand the stroke severity based on the patient's symptoms, and it can help guide treatment decisions going forward. Imaging, it's typically used to differentiate between ischemic and hemorrhagic strokes and to localize the blockage. CT scan, it may appear normal in the beginning for ischemic strokes, but later on you'll see the brain tissue swelling, loss of gray-white matter differentiation may be visible. So MRI is more prompt and more sensitive for detecting ischemic strokes within minutes to hours. Lab tests, they help to determine the underlying cause and guide treatment. You're going to be focusing on imaging, but I have highlighted here coagulation profile, just to see if the patient was on blood thinners, and that's important to know. Treatment, I have a diagram here, like if it's a stroke, like the triage, like what to do. The stroke, if it's hemorrhagic, they go straight to the neuro ICU. Ischemic, it keeps going down and down. But this is good to have on hand. Main treatment focuses on restoring blood flow to the affected area of the brain, preventing further damage, and reducing the risk of future strokes. With thrombotic, the treatment, the goal is to break up the clot, which again is formed directly in the brain, or remove it and address the underlying cause. TPA, such as alteplase or alteplase, dissolves the clot and restores blood flow to the brain, administered within 4.5 hours. Mechanical thrombectomy, this is the surgical procedure from a large artery like the MCA, which is typically done within 6 to 24 hours of occurrence. Antiplatelet therapy, like aspirin, which inhibits platelet aggregation. It's given 24 to 48 hours of stroke onset to prevent further clot formation. With embolic, the goal is for treatment, it focuses on both dissolving the clot, again, the blood clot that formed from elsewhere in the body, and preventing future emboli from forming. So TPA and mechanical thrombectomy. But where it differs is, or I guess just a difference. Anticoagulation therapy post-stroke. Warfarin, this maybe started after, typically about 7 to 14 days, and these anticoagulates help prevent future embolic events by preventing new clots in the heart to form or anywhere else in the body. Some AI, deep learning and CNNs, which are AI models based on CNNs used to analyze imaging data like CT and MRI scans. These models can rapidly identify the signs of ischemic stroke and detecting blocked or narrowed blood vessels in regions of the brain affected by reduced blood flow. An example of this is Viz.ai. It's FDA approved. It's software that analyzes CT images, and the software alerts healthcare providers and expedites treatment. It's all about getting faster care. And these are my references. Thank you so much.